Welcome to Savita Dental College Lecture Cast in Prosthodontics. Today's topic for discussion is special complete dentures. The most commonly used special complete dentures are complete dentures with mechanical retentive components, single complete dentures, immediate dentures, over dentures, and obturators. Conventional complete denture with mechanical retentive components. It is used when retention is compromised due to residual ridge resorption. Mechanical retentive components can be used to increase retention. Most commonly used mechanical components are springs, intramucosal magnets, and suction discs. Single complete dentures. Some patients may have a completely edentulous maxilla with a partially edentulous or completely dentulous mandible. These patients will require a maxillary complete denture opposing a complete mandibular dentition or a mandibular partial denture. Single complete dentures always pose a problem to the dentist. Patients using this design have a tendency to confine their masticatory load to areas where natural teeth are present. This produces an unfavorable force distribution which can lead to adverse soft tissue reactions like hyperplasia or ridge resorptions. Usually, single complete dentures, occlusal modification of the remaining natural teeth is always required. It can be done in one of the following methods: Swenson technique, Dijkstra's technique, Bruce technique, or Boucher technique. Single complete dentures can be of the following types: maxillary complete denture opposing a mandibular natural dentition, maxillary complete denture opposing a mandibular partial denture, mandibular complete denture opposing a maxillary natural dentition, or mandibular complete denture opposing a maxillary partial denture. Maxillary complete denture opposing a mandibular partial denture are clinically very significant due to their complications. The most common complication involved in these type of single complete dentures is combination syndrome, wear of the natural teeth, and fracture of the teeth. Combination syndrome was identified by Kelly in 1972 in patients wearing a maxillary complete denture opposing a mandibular distal extension processes. Combination syndrome progresses in a sequential manner. There are two types of sequences involved. Sequence 1 includes the patient will tend to concentrate the occlusal load on the remaining natural teeth for proprioception, and hence there is more force acting on the anterior portion of the maxillary denture. This leads to increased resorption of the anterior part of the maxilla, which gets replaced by a flabby tissue. The occlusal plane gets tilted anteriorly upwards and posteriorly downwards due to lack of anterior support. The labial flange will be displaced and irritate the labial vestibule, leading to formation of Epulis fissuratum. Posteriorly, there will be fibrous overgrowth of the tissues in the maxillary tuberosity. The shift of the occlusal plane posteriorly downwards produces resorption in the mandibular distal extension denture bearing area. Due to tilt of the occlusal plane, the mandible shifts anteriorly during occlusion. The vertical dimension at occlusion is decreased. The retention and stability of the denture is also decreased. The tilt in the occlusal plane disoccludes the lower anteriors, causing them to supraerupt. This reduces the periodontal support of the anterior teeth. The supraerupted anteriors increase the amount of force acting on the anterior part of the complete denture, and this vicious cycle continues. Sequence 2 was proposed by Craddock. There is a gradual resorption of the distal extension residual ridge in the mandible. This leads to tilting of the occlusal plane posteriorly downwards and anteriorly upwards. The rest of the process is similar to sequence 1. Immediate dentures. A complete or a removable partial denture constructed for insertion immediately following the removal of natural teeth is defined as an immediate denture. It can be classified into interim immediate denture and conventional immediate denture. Advantages of immediate denture includes it gives a psychological benefit to the patient, less postoperative pain, postoperative hemorrhage and infection are also prevented, tooth size, shape, set selection and arrangement are easy. Disadvantage is it requires more chair time and it's relatively expensive. These are the clinical process steps involved in fabrication of a immediate complete denture. Tooth supported over dentures. It is defined as a dental prosthesis that replaces the lost or missing natural dentition and associated structures of the maxilla and or mandible and receives partial support and stability from one or more modified natural teeth. General consideration during diagnosis and treatment planning for an overdenture includes maintenance of periodontal health, reduction in crown root ratio, success of the endodontic therapy, coverage of the denture bearing area, design of the denture and ease of use. Advantages includes integrity of the residual ridge, improved retention and stability, improved proprioception, psychological effect on the patient, and it can be realigned if abutment fails. Disadvantage includes periodical maintenance, incidence of caries and periodontal diseases around the abutments, frequent reviews, and more expensive than the conventional dentures. The abutment selection process includes evaluation of the periodontal status, evaluation of the location of the abutment, and the endodontic and prosthodontic status of the abutment teeth. Clinical procedures for overdentures includes preparation of the abutment teeth and cementation of copings. Followed by that, a conventional complete denture processing is done. Implant supported overdentures. An implant supported overdenture is a type of overdenture that is supported by and attached to implants. A regular denture rests on the gums and is not supported by implants. An implant supported denture is used when person doesn't have any teeth in the jaw but has enough bone in the jaw to support the implants. Implant supported overdentures can be classified into two types. Either they can be bar retained dentures or ball retained dentures. Thank you.